Are you pregnant and wondering whether it's safe to fast Ramadan? Would you like to learn ways to manage your diabetes in Ramadan? Do you work out and want to know how to maintain your fitness and your health in Ramadan? Would you like to learn ways to ensure you get good nutrition during the fasting month? What does science say about fasting? For all these questions and more, join me, Ali Coleman, for a special program that we'll have for the entire month of Ramadan. Every day during the month of Ramadan, Ramadan for better health. Stay healthy and stay tuned.
Ramadan, welcome holy month Ramadan. Ramadan, welcome holy month Ramadan.
Assalamu alaikum and welcome to another edition of Ramadan for Better Health. We appreciate you tuning into the program. We've been having this program specialized to provide medical information to help you be more successful in performing this very important pillar in Islam, fasting for the holy month of Ramadan. Today we're going to be talking about abdominal pain. We are joined by our brother here. He's a specialist. He's a surgical consultant, Dr. Tamir Rashdi. Assalamu alaikum to you, doctor. All right. So all of us at one time or another have a stomach ache, some kind of abdominal pain. Talk to us about this. How do we know if it's serious, and how do you categorize these types of, the common pains we have to other things?
Abdominal pain is a complaint of every one of us at some point of time in his life. This abdominal pain may be subtle stomachache or abdominal colic, maybe sharp, severe, stabbing pain, persistent, continuous. How to know that I have a problem, this is a problem, I should call my doctor, I should visit my doctor. There is some indicators that I should call my doctor or visit my doctor tonight. Like having fever with abdominal pain, like having repeated vomiting with abdominal pain, like having repeated urination, increased frequency of urination above the normal, or increased painful urination, or severe constipation. These things, if accompany abdominal pain, we should call our doctor or visit the doctor at this night. But what could trigger me to call my doctor now or visit him now? Emergency.
Red flags.
Red flags. 4 red flags. 4 red flags to visit the doctor now or call him now. First is vomiting of blood. Second is black stools. Third is severe pain or persistent pain in a pregnant female. Fourth is difficulty in breathing. or what doctors call dyspnea accompanying the pain. And we shall say that recurrent pain and persistent pain is also very important landmarks patient should call doctor for him. Most of us take it easy and take some of on-the-counter medications like analgesics or aspirin or like this, and if even more serious pains will go with this analgesics, but the recurrence or persistence of pain or the accompanying symptoms, like we have said, fever and vomiting and or other symptoms, is a red flags to call the doctor.
Okay, so in Ramadan, I'm sorry, we have an unhealthy culture, an unhealthy habit of eating too much to break the fast.
Yes.
All right. So all of us have a little discomfort, you know, if we do this. But what you're talking about is something entirely different. You're talking about severe, piercing pains in the stomach. These are red flags.
And persistent pain.
And persistent.
Not going with moving or going to the bathroom and like this. Persistent pain accompanied by other symptoms, not only pain. The pain in the abdomen may arise from many conditions. Just increase in the gastric acid or gastritis, reflux and heartburn, some inflammations in the colon like colitis or other things, some colics due to over-distended abdomen with foods. These are simple causes. May be a stone in the gallbladder causing pain, inflammation in the appendix causing pain, stone in the ureter or the kidney causing pain, some much causes, and the famous pain of menstruation in females is also to be noted. These much causes, but what are the serious? When to call the doctor, and when I visit my doctor, what will be done?
Doctor, let's talk about a very small organ in the body, the gallbladder.
Yes.
What is it, and what is its purpose and function?
The gallbladder is a pear-shaped organ or hollow viscous situated just below the liver.
Below the liver.
It's attached to the liver actually, and it is a storage organ.
This is the green
yes,
organ?
Yes, that's a green organ. It is colored green in relation to its content. It is a storage organ for the bile. The bile is the fluid secreted by the liver to digest and help the absorption of the fat. So, when the liver is synthesizing or making the bile, it needs a storage site to be secreted into the GIT when we eat fat meals. This storage site is the gallbladder. In some people, due to many causes, even some causes are not well known, there is a stone or multiple stones is formed inside this organ. When we eat fat meals or meals containing fat, this organ is trying to pour its content into the GIT and contract. When contract in the presence of a stone, it will lead to pain.
Yeah. Doctor, just to clarify, when you say fatty meals, you mean like when we're having a piece of chicken and we eat, or beef, and we eat that fatty meat from the cow? Is this what you mean?
This,
Okay.
And little more or less than this. There is a sensors, receptors, know this is fat. So it say to the gallbladder that you should contract now to digest this fat. When the gallbladder contract, pain comes. This pain is characteristic. First, this pain comes after meals by half an hour to 1 hour.
Is this a photo of some stones?
This is a stone. This red flag around the stone, meaning that the stone making inflammation around it. When the fat meals is taken after half an hour or 1 hour, the gallbladder contracts, the pain comes. Where is the pain? It's on the right side of the abdomen, anteriorly and upper, just below the right lower rib.
Okay.
Just below the right lower rib, pain after meal, and this pain is radiating to your shoulder or your back. And some patients say it radiates to my anterior chest wall. This collectively sites of radiation of this pain.
So this is very helpful, doctor, because the stomach is on the left side.
Yes.
Right? And so if we have a pain after we eat, that's
on
coming
the right
from the right side,
and radiating to the shoulder, right shoulder, this could alarm me that I have a gallstone and I should see a doctor.
A doctor.
What will the doctor ask about? Site of pain, timing of pain, radiation of pain, and this, what will the doctor ask from me of the investigations? He will ask about ultrasound. Ultrasonography is very sensitive to gallstones and very successful tool to diagnose gallstones. Above 97% of gallstones is diagnosed by ultrasound.
Okay.
Now this is explaining the mechanism and how the bile is stored in the gallbladder. Now this fat particles will call the gallbladder through this enzyme CCK to pour its content through the gallbladder channels or the common bile duct into the duodenum to digest and to absorb the fat. Now the fat meets the bile in the duodenum and the absorption continues for the fat. After asking for ultrasound by our doctor, he will see the gallstone. There is a rule: gallstone plus symptoms, especially pain, means until now surgery. Surgery. If there is any solution other than surgery, yes, there is medications like ursodeoxycholic acid. There is lithotripsy like renal stones and ureteric stones, but this routes of treatment mild successful, not successful to the end because of the high recurrence rate and the high failure rate. Up till now, all over the world, the only successful solution to treat the gallstones plus symptoms is laparoscopic cholecystectomy. Is the golden standard to remove the gallbladder and the stones inside it by the laparoscope. Not like the renal stones or the ureteric stones, we remove the stones only, because once the gallbladder is stone forming and diseased, even if we remove the stones, we cannot leave the gallbladder.
Now, I'm very curious about this term. We say gallstones.
Gallstones.
Now, does it really mean that they're like rocks?
They like rocks.
What is the material?
The material is basically or intrinsically maybe 4 types, but the most common type is cholesterol stones. Cholesterol stones. And there is mixed stones of cholesterol and other pigments, and there is pigmented stones. This much types, but the most common is the cholesterol and the mixed stones.
Cholesterol. So this is a connection to the fat that we consume, right?
Yes, but in some patients, even if they not consume much fat, they have these stones. There is no strong relationship creation between the intake and the formation of stones.
I got it. So they're made of cholesterol. What were the other materials?
Pigments of the gallbladder formed from degradation of some blood products and like this, and bile salts, some salts and like this.
So whatever the case, they're very hard.
Some of them very hard, some of them friable. This is an example of one case. This patient is having a bag of stones.
Wow.
Full of hard
stones.
It's full. But some patients may have one small stone, half centimeter, and making the same symptoms. And maybe even more risky.
Wow. That was, I think I saw the measurement was about 6, is that centimeters?
Yes. And even some of them have one small stone, 3 centimeters or 4 centimeters.
Wow.
That's different from patient to patient.
Yeah. Wow. Okay. So if we have, I think the brothers have another photo to show us.
These are other gallbladder stones. No, you should know that these stones and these gallbladder conditions affecting females much more than males, especially those females between the age of 30 and 40, and those with multiple children. Making pain, but we are not going to surgery only for pain. We are going to surgery for other indications, because these stones may harm the patient, big harm, other than pain, like pancreatitis may cause inflammation of the pancreas, which may be very harmful to the patient, may cause obstructive jaundice may make the patient yellowish discoloration and jaundice and harm the liver, and may cause recurrent cholecystitis and acute stage and fever and like this, making the life condition worse.
That last photograph had different sizes. Were all those stones, the small black ones, and then these really, wow, that was really big. Yes. When we come back, we want to continue. We're going to take a break right now. When we come back, Doctor, we'll ask him to talk more about the surgical interventions and when the doctors and the patients decide together to do a surgical intervention. We'll take a short break and then come back with the rest of the program. Assalamu alaikum. Welcome back to the program. We are joined by Dr. Tamir. He is a specialist, a surgical consultant. We're talking about abdominal pain, and the surprise is that all sources or all root causes of abdominal pain is not the stomach.
No, no, no. We are talking about it like stomachache in a general comprehensive talk, but there is many causes. If you have pain in the right side of the abdomen, it will go stone like this. If it's up below the ribs, or if it's down on the right side of the abdomen and persistent with fever, it may be appendicitis. Maybe some loin pain may be related to the kidney, like infection in the urine, or stones, or some crystals in the urine.
You mentioned appendicitis.
Yes.
I think we have. Do we have a video to show about appendicitis?
Yes.
This is inside the gallbladder? Or
yes, this is inside the gallbladder, showing the stones and the stone formation. This one stone is going this is the effect of the stones on if longer standing the wall of the gallbladder.
It looks like
making
it's
it fibrosed and contracted.
Yeah.
Making it old due to severe repeated inflammation due to the injury of the stones to the gallbladder.
Okay, can you talk a little bit about appendicitis?
Yes, appendicitis is the most common surgical cause of abdominal pain. The most common cause making abdominal pain patient going into surgery. And its surgery is a simple surgery actually. Could be done now laparoscopically, small incisions, but the problem is the diagnosis. Okay. If the diagnosis is delayed, it will be a problem because it may make the patient much troubles like peritonitis, abscess in the abdomen, rupture of the appendix, and this is harmful to the patient. How to know that I need to ask my doctor for advice and I suspect I have appendicitis? Pain. How pain of the appendicitis start? It starts in most patients in the center of the abdomen, around the umbilicus. Then it travels, leaving the site to the right side of the lower abdomen. And this pain is persistent pain. It may be mild or moderate or severe. Not the severity is the question, but the persistence of pain. Then it could be with fever and some nausea. You need to vomit, but don't vomit, or vomiting, actual vomiting. It may be your patient may have diarrhea or constipation or polyuria or burning of urination. All of these may be with or without appendicitis. But this right lower abdominal pain, which is persistent and with fever and with vomiting, should actually raise the suspicion for appendicitis. Then the patient will go to the doctor, and the doctor will ask for ultrasound first. Then the golden standard to diagnose appendicitis, if it's not diagnosed clinically and by ultrasound, is a CT.
So to do the diagnosis, the ultrasound is the golden standard. Like
not the ultrasound is the golden standard in the gallstones.
On the gallstones.
But the appendicitis, the golden standard is a computed tomography, CT with contrast.
What is that? What is computed?
This is a modality of investigation when we are giving a contrast for the patient to go through the GIT orally or injection contrast, and we are taking pictures of every centimeter of the abdomen by X-ray machine, but modified to get more accurate and detailed view of the internal abdomen.
Okay, got it. So they consume or have injected a material
To be photographed by the X-ray.
I got it. Okay.
But a specialized X-ray in cuts. So this computed tomography. Tomo a cuts. Like cuts of X-ray, but specialized.
The brothers have a video or a visual for us to show when it's ready. We can talk. Here it is.
This is the GIT from the esophagus above till the end of it below, and showing the appendix on the right side, the most right side and lower down.
The tiny.
This tiny projection from the cecum. Small, maybe 2 centimeters in children, up to 10 centimeters in some adults. And its caliber maybe between 1 or 2 centimeters, not more. But during infection, it's distended, maybe full of pus, full of infection, and may rupture inside the abdomen of the patient. Once diagnosed, we shall go into treatment. The most common and the most applicable treatment worldwide is surgery to remove the appendix. Removal of the appendix may be done through an incision, a small incision, 2 centimeters or 3 centimeters, in the site of the pain, or done laparoscopically through 2 or 3 incisions, 1 centimeter each. This is the appendix shown in the picture, like small projection from the cecum. Cecum is a part of the right colon, which is dilated.
What about, can it strike anyone at any age, at any stage of life?
It's very common in the middle age, between the age of 15 or 20 till the age of 40. But it's rare actually in the children group or the elderly group, but it's occur. And every day we see cases. But it's rare. It's less common. The most common is the middle age group.
So if we're over 40, does it mean, and we haven't had
not immune against it.
Does it mean that if we were going to have it, that we would have had it by now? If you're 45, 50 years old?
Yes, even 60 or 70, some patients. Should suspicion remain in the brain of the doctor? This is the site of the pain. He's catching his right lower abdomen.
So it's very intense pain, huh?
Not in all cases.
Not in all cases.
Even renal colic pain caused by renal stones or crystals may be more and more severe and more sudden. But our pain is persistent with a special site and a special accompanying symptoms.
Okay, so we've been talking about appendicitis.
And cholecystitis, we have talked.
Is it once you do surgery, the success rate, is it a high success rate?
Yes, it's simple surgery, done even by less expertise surgeons. For every patient, it give good results and without complications, except in very few cases. I have told you it's most common done case in the world in abdominal pain surgery.
So there's something about I don't know how to pronounce it, re-down pain?
This method of examination by the doctor is pressing the pain site and releasing his hand, and this lead to vibration of the peritoneum or the coverage of the appendix, making more pain. But it's done by physicians, not the patient itself or a relative.
Yeah, okay. All right. So I think we've been talking about all these different sources that can cause abdominal pain.
Yes. We have talking now about 2 right-sided abdominal pains, which are serious and need surgery. One of them needs surgery, not immediately, but within 1 week or 2 weeks or 1 month. The appendicitis needs surgery the same time, it's emergency. But this is the method of removing the appendix or the steps of removing the appendix. But there are much causes we should consider.
When they perform this operation, are there any challenges or complications that arise?
No surgery without complication. No surgery without complication.
That's right.
But the percent of the complications, the severity of the complications, could we detect the complications? Could we manage the complications? The successful management of complications? Every item of this is a good item to discuss. Most above 95% of the complications of the appendix are simple complications and could be managed. remain 5% complications, which may be harmful. But remember that it's emergency, must to do operation.
You mentioned that sometimes, even on itself, before there's a surgical intervention, the appendix could burst.
If inflamed.
If it's inflamed.
Yes.
Is that a potential risk when you go in to remove it?
Much risk. It's burst, it will be due abscess inside the abdomen and the inflammation of the surrounding organs and much adhesions between the organs and makes the operation difficult and makes the outcome less successful. So when diagnosed, should be operated, not to be delayed. Some patients be afraid of surgery. You will open my abdomen, especially females, and make a scar and like this. I may take some treatment and avoid the surgery. You may avoid the surgery, but under the supervision of your doctor, not to delay surgery because you are afraid and will go to more grave complications, which need more aggressive surgery and with more complications.
I'm becoming fearful. I want to know what I can do to prevent this. Is it diet induced or more genetic or
no known cause? No known cause could be the surest cause to cause the appendicitis. For cholecystitis, maybe some food changes, decreasing fat and diet, having more exercise, but genetics still have a rule, and you cannot avoid this. Also, obese patients in cholecystitis. Obesity is a risk factor of cholecystitis, and also rapid losing of weight is a risk factor for gallstones. When patients lose weight rapidly, it may go to gallstones, and we are seeing much patients losing weight rapidly and gaining weight rapidly. This make higher risk for gallstones.
We are at the end of the program. Thank you so much for being with us, and inshallah we can have you back for other discussions. And again, thank you for being with us, Doctor. Okay, this is Dr. Tamer Rashdi. He is a consultant in surgery. We appreciate him being here to join us to talk about the various types of abdominal pain. We hope, inshallah, you can take something beneficial from this. We'll be back with more, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh.